When I found out that Overlook had it available, that's when I was able to basically say, hey, I know that we can take this idea and use it in a way to give patients a little more access to their surgery and show them their anatomy and sort of explain with more detail. If you are a candidate for a total shoulder replacement or reverse total shoulder replacement, then what we'll frequently do is get something called a CAT scan, and we use that data to build a 3D model, first digitally, and then we take that and actually print it out. It's helpful because I can anticipate what am I going to see when I look into your shoulder in the operating room, and it helps guide the patient so they understand the potential risks, but also the potential benefits of everything we're going to do. We've essentially gone through the surgery in our mind ahead of time. It is really cool to know that this technology it's here already, and we're using it to advance patient care.